itself. We started as just 30 or 40. We're now up over 4,000. We come from 70 countries, more than 400 organizations. We have 10 very, very active working groups to which you're all cordially and even not only invited, but implored to participate. Because as an entirely voluntary group of people, this community of practice is only as good as its members, and each new voice makes us stronger. I'll tell you just a little bit about what we've been doing by way of setting up today's conversation. We have, from the beginning, been running a series of active webinars. We've probably run several hundred over the years, some by the larger community of practice, some by one or the other of the working groups. We do quarterly newsletters. We've done 28, soon to be 29 of those. We've done a series of thought products, knowledge products, including one that's going to get featured this morning, perhaps our most ambitious so far, which focuses on what it really takes for funders to incorporate a conscious and deliberate and systematic approach to scale inside their standard operating procedures. That sounds like it might be simple. I promise you it's not. But we've had the benefit of so far a dozen organizations that have worked with us to look at their own practices and try to understand what works, what doesn't, and what can be done. And that's what we're going to be highlighting today in our first plenary out of what will eventually be 12 in this year's annual forum. Tomorrow will be another plenary focusing on what a number of us think is a wonderful book that Isabel Guerrero and some colleagues have written about scaling. It's called Scaling Development Impact. But we're going to use that to try to unravel what some of the most pressing issues are in scaling today. That's going to be followed on successive days, same time slot, by 9 different sessions run by 9 of our 10 working groups, one working group on each session. Please check out the agenda to see which ones fit your interests most directly and sign up. And finally, on day 12, which will be March 26th, we're going to take a look backwards at some of the major issues and their implications for us as a community and also for the larger development and climate community in terms of what that really means for scaling and for trying to make it all a more professional and more effective enterprise. I'll say just one more word about our ambitions as a group. For the first 9 years, which means almost till now, this community of practice is focused on what I would call peer learning. Basically, we've been here to help each other. We're now equally committed to that, but in addition, we're committed to trying to do something I would say more ambitious, which is we're trying to take on the task of trying to change development and climate practice. Having now seen where some of the possibilities and some of the limitations are on trying to really scale outcomes, we really want to try to use our voices to move the practice of funders, implementers, and scholars about what it really takes to do development and climate change effectively. And so you could say we've taken on an advocacy agenda, and we welcome you into that community just as we do into the learning community. I'll say just a word on logistics, and then I'll come to today's session. For those of you for whom English isn't a first language, or if for whatever reason you like you're a multi-source learner, we have the possibility of 2 things. One is there's closed captions. The closed captions are in English, and today's speakers will be in English. But some of us, it helps us to read at the same time we're hearing. You can do that by going to the More function on your desktop and pressing the English subtitles, the English captions. Similarly, for those of you who would prefer to listen in a different language, we have Spanish and French possibilities or simultaneous interpreters. Again, you'll be given the option to choose the language of your choice. The speakers live will be speaking in English, but you can listen in the language of your choice. We hope you'll use the chat box very actively. We'll be monitoring it, both for questions and also for follow-up after the session. And we invite you to put in comments, questions. There's a way to comment on other people's comments if you want to do that, or just enter your own. Again, we hope you'll do this actively starting now. Finally, let me turn to today's session. As I mentioned, today's session is focusing on this issue of what funders can do to make scaling a more permanent and important part of their approaches to things. And for that, we've got the world's best moderator, Poonam Mutreja, who's calling in from India for the purpose. Poonam is the executive director of the Population Foundation of India, and a lifelong advocate on women's issues and health issues. I've known Poonam for perhaps 30 years, and she and Richard and I were involved from day one in this scaling work in India when she was then the head of the MacArthur Foundation's programs in India. I can't think of anybody better qualified to take this conversation forward. And Poonam, thank you again for calling in your evening to join us today.
Thank you, Larry, and it's an absolute pleasure and honor. So good evening from India and good morning to all those joining from America and other countries, perhaps a different part of the day. I am indeed really grateful. Everyone says that, but I mean it. I'm very grateful to Larry and Richard for inviting me to participate in this webinar and moderate a very important session on mainstreaming scaling up, which I am very passionate about, as you will find out soon. It is a privilege to also interact with such an eminent group of people who are not only on the panel, but also participating. I'd like to begin with the motto from BRAC, an incredible and large NGO in Bangladesh, which many of you may have heard about, which I hope sets the tone today. Small is beautiful, but big is necessary. And ever since I heard their motto, I have been inspired to not be small and big. And I hope you will all feel equally inspired. So global and Indian experience has shown that very few innovative projects went all the way to effectively implementing large-scale impact. I tend to use two not very optimistic words, but if you want to, when I'm more optimist, I call pilots in India a junkyard. When I'm less optimistic, I call that a graveyard. And that is what really got on my journey to look for how we can solve this awful situation where I'd seen pilots all across the country. Larry didn't give my age. I'm glad he didn't, but I've worked for 4.5 decades, so you all can guess. And one of the reasons I did find this was there were innovations, but they didn't succeed in scaling up, happened because people thought this is automatic. It'll happen automatically. If I do a good pilot, it'll get scaled up. In fact, when I started working in the development sector, it was called, it'll expand. It'll expand to the villages. That was the assumption of a lot of innocent, well-meaning pilot innovators. What was missing is the fact that, one second, that systematically no one had talked about scaling up. So we did this search where somebody told us about MSI, and we connected with Larry, and that's when our journey for scaling up began more than 2 decades ago. I was with MacArthur Foundation, and we ended up partnering with the MSI to develop and build an in-country capacity to apply scaling up for management, a SUM framework that was developed by MSI. The idea was to scale up innovative pilots in the health sector, nutrition. MacArthur had offices in Mexico, India, and Nigeria at that point of time. And I can tell you one thing, mainstreaming scaling up was very much on the mind of the team and leadership at MSI. And the first thing they asked us was, if we could have an intermediary organization in India. And I shared a number of organizations which could have been intermediary organizations. And Larry chose PFI, Population Foundation of India, where I work now. And I am wondering if Larry also had mainstreamed in his mind that one day I will move from MacArthur Foundation to Population Foundation of India. And I'm sure he sent Richard to India to spend almost 2 years in India to sow the seeds. So I see a big conspiracy theory here, which has really benefited me personally, the organization I work for, and many, many movements. And the MacArthur Foundation made grants in India, which to both MSI and PFI. I was, the DNA of a donor was completely, if it is possible to change after you've lived for a certain number of years, but we were at our infancy. And I can tell you, whatever we hear in the presentation from which will be soon after, as soon as I can keep myself quiet. Richard and Lynn will make the presentation. I want to tell you that it made it very hard for our grantees, existing grantees and future grantees, because we had a scaling up lens. So I don't know how much good we'll be doing to the world, mainstreaming scaling up in the donor world. It'll be hard for a lot of NGOs who won't be able to deal with that. Finally, I want to just share with you that, our on-the-job training in PFI was done by, as I said, Richard was sent for 2 years to India, and with guidance from Larry, we were given on-the-job training, those people who were in PFI. And it resulted in, as I said earlier, not just MacArthur Foundation, but at Population Foundation of India, we cannot do a program today. We are incapable of doing a program which doesn't go to scale, where the planning is not done for a scaling up. And some of the things that were the outcome, and I want to give you a few quick insights. And these are training of staff and partners to understand and adopt scaling up management framework for all their programs, not just the program we spoke to them about. I think Richard, if I'm right, we ended up training 500 senior management staff from national and state governments, donors, implementation organizations on scaling up management. Guided and mentored 15 NGOs and government-led pilots in visioning and exercise systematically planning for scaling up. And all this finally did result in 3 quick 2 lines on 3 projects that went to scale. And the first was Community Action for Health, which we piloted, which was piloted by PFI in 2005. The pilot started, and in 2022, we are working in 250 lakh villages in India, 250,000 villages, and across the country. The home-based newborn care model, which Richard, you will remember, doing a scalability feasibility assessment, that has gone to scale nationally, the home-based newborn care across the world, in India and across the world. And finally, I want to say some of the lessons that we learned were: 1, investing in an intermediary is very important. 2, simplification of the model and its processes is another thing we learned. And without that, a lot of, if you don't do that, big stumbling blocks have taken place where leaders and organizations have totally suffered from. And finally, the last 2, evaluation and identifying and working with champions. The presentation that we are going to now go to by Richard Kohl and Johannes Linn is the next on the program. And after that, we have three great panelists, and the panelists will respond to questions moderated by me. And then finally, we will have closing observations as from Ben Kumpf. If I've said your name properly, if I haven't, forgive me. And then we will have the takeaways. We will also have, a response from the panelists after the comments from a response from Richard and Lynn after we have heard from the panelists. So may I, without further ado, introduce the panelists? Richard, do I introduce you too? You're on mute. Or does everybody know you like everyone knows you in India?
No, not everybody knows either Johannes and I, but perhaps I can...
No, I'm just teasing you. I'm just teasing. I'm just trying to tell people how well known you are in India for your for all the trouble you gave them in scaling up instead of doing small pilots and, putting them in their junkyard. So, Richard Kohl is clearly an expert and a leader on scaling impact. And for 25 years, Richard has, should I say, Dr. Richard Kohl has identified and solved complex problems for foundations, private enterprise, both social and private enterprise, international agencies. He's highly valued for his abilities to assess programs, synthesize the findings into compelling narratives, and I have been witness to that. For the last 15 years, Richard has specialized in developing and implementing scaling and growth strategies, and Dr. Kohl also integrates his expertise in scaling up for over 25 years as a Buddhist practitioner, teacher, and business coach. He works with organizations where they are now the results for sustainable impact at scale. And finally, I'd like to say that I have to say that a lot of what my colleagues and I learned using the language, but putting it into practice, was from MSI, and Richard Kohl was their big ambassador to India. Over to you, not over to you, Richard. Allow me to introduce Johannes, who is a non-resident senior fellow at the Brookings Institute. We haven't had the privilege to meet, but it's nice to see you online here. Johannes is a non-resident senior fellow at the Brookings Institution, a distinguished resident scholar at the Emerging Market Forum in Washington, D.C., a senior fellow at the Results for Development Institute, and senior research fellow at the International Initiative for Impact Evaluation. He has also co-founded and co-chaired the International Scaling Up Community of Practice. He currently serves as global facilitator of systematic observation financing facilities, which is SOFF, right? And right. Before that, he worked as for several decades at the World Bank, including as the bank's vice president, and has a degree from Oxford University and a doctorate in economics from Cornell University. So I wanted to give a proper introduction in detail as we wait for the new research synthesis, which I am very excited, and I'm sure everybody's very excited to hear about and see how the donors are doing, who are always measuring us. So over to both of you.
That's great. Thank you very much, Poonam. Let me start and maybe ask Gabi for the slides. Can we put up the slides, Gabi? Great. I think they're coming up now. So uh, good morning, good afternoon, good evening, everybody, and a special thanks to you, Poonam, for being with you in your evening tonight. What we're doing here briefly, Richard and I will be to present where we are with our 2-year study initiative on mainstreaming scaling in funder organizations, tell you a bit about the findings and also the lessons of where we are. And we look very much forward to lots of feedback because this is work in progress, and the more input we get, the better will be the results. Let's move on to the next slide. I'll quickly give you an overview of what we're up to. So 2-year action research program, and there's a concept note which you can find on our website, the Scaling Community Practice website. Why are we looking at mainstreaming scaling in funder organizations? Well, it's pretty straightforward. If you just listen to Poonam, you know, too many times funders have supported what we call pilots to nowhere, or you know, operated on the magical thinking that since something works so well in the small, yeah, somebody will pick it up and run with it. So we think funders should actually play could play an important role in facilitating scaling, but actually often, unfortunately, they're hindering it. So the purpose of the research is to inform on current funder practice, to draw lessons and promote mainstreaming of scaling by funders, with an audience of funders, hopefully, recipients, development experts and practitioners, and of course, you know, the community of practice as at large. What in terms of our approach, we've been looking to have maximum involvement by the funder organizations, funder partners with whom we've been working, because we believe that's the best prospects for actually change to happen in these organizations. The research, we're in about a year and a quarter into this work. We've had 13 collaborative case studies of selected funders, and I'll show you the list in a minute. We have a number of them, about 10 of them already published, posted on our community practice website. We're also working in cooperation with OECD DAC and MOPAN on scaling principles and evaluation approaches, and our good friend Ben Kumpf from OECD will join us later. We're currently preparing an interim synthesis report, which will be posted by the end of March, and we're giving you a summary of our findings now. During the second year, our current year, we plan to do more funder case studies with a special focus on foundations, but also hopefully on vertical funds and a cross-cutting review of funder activities in the health sector, and bring in recipient perspectives and develop a mainstreaming tracking tool. Next slide, please. So here is a list of the case study funder partners. It's a fairly broad list in terms of diversity of the funders by type. We have bilateral official, multilateral official funders. We have large international NGOs. We have foundations. We have funders who support research and innovation, and we have funders who support at smaller, medium, and larger scale investment projects. As you can see, a total of 12 funders already far advanced, and a cross-cutting short overview of funder activities in education. And we have 3 funders, African Development Bank, Global Financing Facility, and Eleanor Crook Foundation. Work is ongoing as part of our phase 2. Next slide, please. Now, before I hand over to Richard and let him talk to you a bit about our findings, let me just stress what is the focus of this mainstreaming research initiative. The principal focus is on mainstreaming scaling in funder organizations. It's not on the impact of the scaling process by recipients. So if you look at that sequence of weird-looking circles at the bottom of the slide, we're looking at the initial state of support by funders for scaling in the recipient countries. We then look at mainstreaming actions that funders have been taking over the last few years, that they've been pursuing mainstreaming. And we're looking at the results of the mainstreaming in terms of how they've changed funder practice. But we're not looking yet, at least, at whether or not that has resulted in increased scaling by recipients and greater impact at scale for two reasons. One, because that takes a lot, that last step would take a lot more resources that we actually have in our first 2 years of this research project, but also because many funders aren't actually far enough downstream that you can even assess whether or not there is a significant impact in terms of increased scaling by recipients and greater impact at scale. As important, of course, as this is ultimately, and research that definitely will have to be undertaken. Richard, take it from here on findings so far. Thank you.
Thank you so much, Johannes. Could I have the next slide, please? So if you look at this graph, this is a graph, or a figure, I guess I should say, of that Johannes and others developed a few years ago for the International Development Innovation Alliance, and it shows the pathway from the beginning of an innovation or a project all the way to sustainable scale. And what we've done here on this graph is we've sorted where the various case studies are on this. As you can notice from the title of the slide, this is potentially where they are. Some are actually there or not. Others are not actually where they could be. What I mean by that is if you look at the left-hand side of the slide, which is basically the innovation in research and development, there are many of the case studies like CGIAR, Grand Challenges Canada, the Syngenta Foundation, that are funding innovations or doing innovation, and they are doing those things, and often now mostly preparing them for scaling, which is very exciting. And they have actually moved heavily into stage 4 for reasons we'll discuss in a minute, transition to scale. By contrast, many of the largest organizations occupy the larger funders, bilaterals, multilaterals, are doing large projects, have the potential to take things to scale because they have more resources and are working at larger scale, but in fact tend not to be yet doing that role. And that gives you a sense, though, where things are. So the good news is that we could cover the whole scaling pathway from 1 to 6. The not so good news is that currently we still have gaps in scaling stage 5 and stage 6. And one of the major findings is the larger funders that could fill those roles are largely not yet doing it. The other thing you'll note is that no organization goes from A to Z. Nobody is actually taking things from ideation all the way to scale. Can I have the next slide, please? So one of the things we realize is that, by the way, our sample is not a random sample. We worked mostly with organizations that were already making progress in scaling, integrating scaling, or mainstreaming scaling, and we agreed to, as we got the case studies came in, we realized that they sort of fell into 2 buckets. One were smaller funders, often and mostly funders of research or innovation, or actually innovators themselves. They were foundations or challenge funds like GCC. And the other characteristic were organizations that were the larger project funders. The smaller funders in general, as I alluded to in the previous slide, have made much more progress, but they face a major challenge, which is they only tend to go up to stage 3 or have started to move into stage 4, but they're still looking to organizations that, do we not have the slide anymore that has all the list of organizations? Well, we'll come back to that. Okay. I'll talk about them later when we have more time, but there were 12 organizations. And they're still trying to find organizations to hand off. Some have made better progress on this, but it's a remaining challenge. By contrast, the larger organizations, as I already alluded to, could be doing stages 4, 5, and 6, taking projects or innovations to scale, but they tend not to be as of yet. Even some of those organizations, such as USAID, for example, in its agricultural work, both funds its own agricultural innovations as well as contributing to international research on agriculture in the CGIAR. And while there are many innovations that come from either its own innovation funding or the CGIAR, there's not yet a systematic linkage between the innovation research and development and the projects. Some innovations are, but it tends integrated into scaling, but it's or into projects, but it's ad hoc. The second problem with the larger organizations is that they either aren't designing scaling into their projects, or they're not really doing a systematic job of handing it off to domestic actors for sustainable scale. And this remains a problem. Yeah. Okay. Can I have the next slide, please? So here are the organizations. I'll go through them quickly. IDB is the Inter-American Development Bank and their lab, that's on the left. GIZ is the German development organization. Feed the Future is USAID's flagship agri-food project. IDB is the Inter-American Development Bank. GFF is the Global Financing Facility. It's a trust fund within the World Bank that's supporting scaling of mostly maternal and global health innovations. IFAD is the International Fund for Agricultural Development. CARE, I think most people know, Catholic Relief Services. The CGIAR is the CRS. The CGIAR is the international set of agri-food research centers. IDB Lab is an innovation unit within the Inter-American Development Bank. ECF is the Eleanor Crook Foundation, which focuses primarily on supporting new innovations and scaling of nutrition. GCC is Grand Challenges Canada. GFF I already mentioned. Harvest Plus works on developing and scaling innovations in nutrition and agri-food to target things like stunting and malnutrition. SOF, I don't remember what it stands for, but international organization to support
Systematic Observations Financing Facility, Richard.
Thank you. And the Syngenta Foundation also works in agri-food systems, focusing on smallholder scale farmers, and they take things from lots of innovations all the way to transition to scale. As you can see here, we divided these organizations in terms of their progress on scaling. And I don't have time to explain how we did that, but we will be circulating in a few weeks a paper on all these findings that can give you the details. And as you can see, a lot of the organizations have actually moved fairly far to the right. That's not politically, but in terms of scaling. And what we mean by that is that they have put it to the center of the organization. That doesn't, my name is Richard Kohl, that it doesn't mean that they don't have more work to do on scaling. Many of them still are rolling out things like monitoring and evaluation, but their strategy, their overall approach, etc., is core to what they're doing. By contrast, ones that are further to the left have still a ways to go. They maybe still haven't set goals yet, or have a lot more work to do in operationalization. Can I have the next slide, please? So this gives you a sense of the progress that have been made, and I won't read the whole slide. I want to focus on a couple of areas. Most organizations, and by the way, you know, I am generalizing across 12 organizations, so what I am saying may be true for many, but not for all, have put scaling into their mission, vision, and strategies. And they've created, it's pretty common to create internal support units. Many, though not all, have created concrete, measurable targets for impact at scale. The areas where they've made, in general, much less progress is integrating into monitoring and evaluation, dedicating explicit resources for, especially financial, but also human resources beyond a support unit to support scaling, and integrating it into their operations and procedures. And that last point is particularly true more for the project organizations, the large project implementers and funders, than it is for the innovating funders. One of the other big findings is that almost every organization, even the largest ones, have emphasized the importance of partnerships, but many have found it very challenging to find other partners, particularly the smaller ones, to hand off to. Finally, I want to emphasize that one of the things we looked at was how do different organizations define scaling? When they say they're mainstreaming scale or scaling, what do they mean by that? And we discovered that there were two very different definitions common into the way organizations were working. One is what we call transactional and the other transformational. And could I have the next slide, please? So transactional is still very common out there, and we don't favor that definition in the community of practice. And it tends to be used as doing more, getting more resources, or just reaching bigger numbers. But the bigger numbers tend to be in the context of a project. They don't be in the context of longer sustainable scaling, and by which we mean that there are domestic actors who are continuing to implement this, have the capacity to implement this, and there's domestic funding to continue to implement this, and ideally to continue to scale. By contrast, transformational scaling doesn't look at what a project can achieve by itself, but what it can put in place in terms of actually solving the problem, addressing the problem at scale. So if in a given country there's 10 million people who could benefit from an innovation, it's all great that goes to scale. It's all great that you may have achieved 500,000 people. That's a significant impact. But what about the other 9.5 million people? Transformational scaling, what we're focuses on how do we get to 10 million or as close as we can to the size of the problem. So projects and innovations are designed to go to scale. They're evaluated as putting in place the foundations for scaling, and it may take 2 or 3 projects. We've learned that scaling often takes 5, 10, 15 years. Often they focus on addressing systemic barriers, doing systems change to create internal capacity, to mobilize resources, to improve enabling environments, and they measure their success in terms of how they put in place a long-term process for implementing scaling sustainably and for scaling to continue. And many organizations, particularly the smaller ones, are now focusing on transformational scale. Grand Challenges Canada, CARE, CRS, Harvest Plus, the Syngenta Foundations, but the larger project donors are still very much a work in progress on this. Could I have the next slide, please? Next slide. Thank you. So I'm running out of time, so I'll keep this brief. The things I would highlight here is that the smaller organizations often, the area they've made the biggest progress, or the 2 areas, is they've really changed their organizational culture. Everybody internally, even if they haven't quite dotted the I's and crossed the T's on putting in place formal policies, procedures, of how they integrate scaling into their selection of projects or investments, their review process, though many have, they all talk about scaling. They ask, how is this going to promote scaling from the very beginning and all the way through, whether it's their work plans, their project designs, their investments, their reviews, etc. And that's a huge change. The other one, as I've noted a couple times, is because they've found it challenging to find organizations to hand off to. Well, because of their limited resources, they can't fund and do scaling themselves. They have tried as much as possible to create the preconditions for that by moving into transition to scale. And one of the major organizations that's really been the leader on this is Grand Challenges Canada, which has a whole set of instruments, both transition to scale funding, as well as other types of support like equity investments and supporting other providing coaching and supporting local ecosystems that can support this. It's really worth taking a look at the case study on Grand Challenges Canada and their website. The other, can I have the next slide, please? So in terms of larger organizations, I wish I had better news. but they have faced a number of challenges. I'll just highlight two, but many of them in terms of the way they contract or procure or financial management for their projects really is inimical or antithetical to scaling. Their goals are set in terms of, their 3 to 5 year projects, and it's what numbers they achieve in that period that they really measure themselves and they target, rather than, as I articulated before, transformational scaling. How is a project or a series of projects leading to sustainable scaling over long term? Another interesting challenge that they've faced is internal organizational change. While many senior management have been trying to move the dial on this, despite these challenges that I alluded to about project definition, they have often used a top-down approach, and they often face resistance from middle management and frontline staff, and who are used to doing things the old way of targeting, specific projects, specific deadlines, and goals within those projects. And some organizations have started to try to move this. I think the CGIAR is a very interesting example, which is an innovator, but is a very large organization, and they have been trying to roll out a more voluntaristic approach to getting middle management and staff to integrate scaling. It's early days, so please keep your eyes on that organization. But they are really taking this to heart. They've trained hundreds of staff who are sprinkled throughout the organization to be local advocates, local in the sense of in different research units, to operationalize and support or act as resource people. We'll see how that goes. I'd say just the last point I'd make is that the CGIAR has also rolled out, very early days, but a portfolio approach to scaling. And the portfolio approach really emphasizes looking at the impact of their entire set of innovations or what they're doing, rather than focusing on having all of what they're doing be successful. And I would say this is true of all the small funders like GCC, Grand Challenges Canada, the Syngenta Foundation, have really switched from getting everything to be successful to taking on more individual risk in their projects or innovation investments, so that their overall portfolio can be much more successful in terms of impact at scale. And I think this is really a critical issue that I hope we can discuss more. I'm going to turn it over from here to Johannes.
Thank you, Richard. And so far we've talked a lot about sort of the problems and the gaps that funders face as they more or less try to support scaling. What I would like to do in the closing slides here, in the closing minutes of this presentation, is to sort of say, okay, so what are the lessons of how to do it differently, how to do it better, how to actually mainstream scaling effectively into funder organizations. And we have a few lessons, preliminary lessons here, on what we call the enabling factors of mainstreaming. And the first and most basic factor, maybe not surprisingly, is that if you want to change the way an organization does its business, you need to have sustained leadership as a principal driver. And that's leadership at the top, senior management, the president, the CEO, but it's also the governing body, whether it's the board of directors or the ministry that's in charge of managing, supervising the funder organization. So we need sustained leadership at the top that really pushes an organization-wide agenda. But then what does leadership need to do? Well, we have 11 lessons, and I'll briefly summarize those. First of all, the leadership needs to set organizational scaling vision and explicit targets. And these have to be, in one way or another, linked to individual projects or program. No point having a large vision and targets if you don't actually link them to the projects and the programs that you're supporting. Secondly, you need to offer a clear definition of scale and scaling with a focus on transformational scaling. As Richard explained, yes, transactional scale helps, but it isn't what ultimately we need to affect the transformations required for the large-scale impact that is absolutely necessary. Thirdly, we need to provide frontline staff with analytical tools, training, and knowledge management support, and that has to combine with access to central technical support and resource people. Fourth, leadership has to formulate operational policies and procedures to integrate scaling into program and investment design, review criteria, and quality assurance. And it has to dedicate financial and human resources for scaling, to align incentives for staff and management. Without incentives for staff and management, they won't do it, in my experience, as a manager, by the way, in a large organization. And so it is important that the managers and staff have incentives, that they understand what is required, and the accountability to actually implement scaling as a core mandate. Next slide, please. The sixth enabling factor is to recognize that mainstreaming is an all-of-organization effort. It has to be integrated into the design and implementation of all other mandates, whether it's poverty, gender, climate, etc. So it's not an add-on. It's not yet another mandate, but it's really at the core of getting things done in all the mandates that an organization has set for itself. You need to integrate scaling into monitoring, evaluation, accountability, and learning processes so that you get the information for scaling and tracking progress in scaling and have accountability. You need to leverage localization through country-led platforms and institutions so that you have coordination and alignment with national and international partners. And you have to recognize that this actually takes resources. It's not something that can be done without the time and the personnel and the budget that is necessary to do this coordination and alignment. You need to act as an intermediary for scaling with support for capacity building and sustained systems change. And in this process, also create local intermediaries that can support scaling after you, the funder, departs. Penultimate lesson is that you need to explicitly link funding by larger funders to internal and external innovators and to smaller funders. And you have to provide the financial resources and to implement scaling at later stages in the scaling process. Finally, you need to recognize and address tensions and trade-offs, which you will invariably run into, tensions between scale and equity, quantity and quality, and you need to realize that there's a tension between focus on the short-term results that so many funders are after versus the long-term goals. So last not least, let's have a quick overview of sort of the key messages we wanted to share with you. First of all, what we find is, of course, funders differ where they are on their mainstreaming journey and in the gaps they need to address. But we have three overarching messages. First of all, mainstreaming is complex, a complex change management process, and it requires long-term commitment with a focus on transformational change and on transformational scaling. It requires consistent, sustained senior leadership with integration to processes, alignment of incentives for mid-level management and staff, especially in larger organizations. And finally, for effective implementation, you need to plan, you need to prioritize, you need to sequence across these various elements that I summarized earlier. You need to monitor and evaluate, and you need to make mid-course correction in your mainstreaming process as necessary. Thank you very much. And now we're very much looking forward to comments and reactions. Thank you.
Thank you, Richard, and thank you, Johannes, for the well-researched and insightful presentations. I do, before I go to the panelists, our very distinguished panelists, I have a couple of quick points. And what I'd like to raise is the whole issue of securing government buy-in, which is one of the most critical elements in scaling up, which is perhaps missing in a lot of the donor community, not receiving the attention that is needed. And here I'd like to share a couple of points. alignment of the innovation with the nationals or subnational policies, plans, and priorities increases the chances of getting attention of policymakers and senior bureaucrats. And the value adds that many you mentioned that address some of the inherent challenges in government systems, such as community engagement, social behavior change communications, equity, staff motivation, etc. But behavior change communication, I want to particularly bring in because it can lead to transformational approaches, and that's our experience, and the data and evidence shows that. And, let's remind ourselves when Larry opened this webinar today, Larry talked about the transformational approach we need for climate change. And given that climate change is staring at us, impacting us, affecting us, so transformational approaches and engaging governments is very important. And securing government commitments, such as a great example is the Norway-India Partnership Initiative, where they partnered with the government. And even though Norway has left the project now, NIPI, it's called to improve maternal and child health, the project thrives and survives and is being scaled up across the country. So now I'm going to go very quickly and immediately to our distinguished panelists, and we're very fortunate to have with us. I'm going to start with Anita Sundari Akela, who, as Richard also said in the presentation, has worked on scaling up as Director for Impact at Scale at CARE USA. She's the Director for Impact and Scale at CARE USA, responsible for ensuring the care programs are designed for scale from the very beginning. Anita is a development and natural resource economist whose work has traversed the fields of conservation, livelihoods, business design, and social enterprise. Anita, there is a generic or general question for all the panelists, and I believe I've been informed that rather than 3 minutes, you have 7 minutes each. Is that right, organizers?
Right.
So
I know we're running
right.
a little bit behind, so I think we're going to have to cut that to 5.
Okay, 5 minutes, but 5 minutes is still good news compared to 3 minutes. So the first question that I would pose to all the panelists, and I'll start with you, Anita, is the presentation highlighted a number of findings and drivers and made recommendations regarding mainstreaming scaling. Where do you think Kohl and Linn got it right, not quite right, missed important issues, or things that you might want to add? And if you were to add, what is it that you would add to the synthesis and the findings we just heard? And what would you highlight as some of the key and most important areas? Basically, what I'm saying is, can we lean on this synthesis, or can we glean light? Over to you,
Thank
Anita.
you. Thank you for that, Poonam. I thought there were so many thoughts that were sparked for me as I was listening to this presentation, and I had the good fortune of seeing an early version, an early draft of the paper that will be shared ultimately. And there's a number of things that I think were interesting. One, for sure, and instructive, is the distinction between transactional and transformational scaling. I think that's a really useful construct for how we should be thinking about the ways in which we mainstream scaling into our organizations. What occurs to me with this distinction is that it really requires behavior change from multiple actors at multiple levels. It requires within an organization a mindset shift that I think springs from consistent messaging from and to every level of the organization regarding what constitutes scale. And for me, it's this idea of interventions being adopted, implemented, and paid for by other doers and pairs at scale, rather than relying on grant funding and an organization's own footprint. I think that as long as replication, which to me is doing it through your own footprint using grant funding, as long as that counts as scale, it's going to be hard to move people in the direction of sustainable scale because there aren't strong incentives to do so, including, as the presentation points out, funding. And on that point, I think it also requires donors to be consistent in setting standards for scale and then actually following up to ensure that grantees are adaptively managing with the end goal of sustainable scale in mind, right? And it seems to me that funding for transactional scaling, replication, is easier to find than funding for sustainable scale. And this is linked to project cycles because scaling an intervention can take at least as long as mainstreaming scaling does, so 10 to 20 years. So that's one thought I had. Another one is about the trade-offs and tensions inherent in scaling, which manifest themselves in the difficulty that institutions have in mainstreaming scaling. And what I'm thinking of here is that complexity can be the enemy of scaling. So, as the authors have said, scalability often requires simplification of program design to reduce costs given long-term resource and capacity constraints. And yet, for a bingo like CARE, whose scope is so large, the expectations that others have of us, and indeed our expectations for ourselves, are much larger than, say, they are for like a social enterprise, which has the luxury of doing one thing really well and then creating and supporting an ecosystem around that one thing. And so our interventions, by the nature of the complexity that's inherent in the challenges we're trying to solve, our interventions are complex, which makes them hard to scale. And so I'd love to hear what the authors, other panelists have been thinking in this regard. How do we balance these things? I love the idea of this magical thinking that's happening around the fact that things will just scale. I would say that it also extends to magical thinking extends to what version of something can scale. So, we do, as international organizations, hard things in hard places. But when they're within the context of a grant-funded project, we do everything we can to set those projects up for success. We throw the best capacity, the best capabilities, the most resources that we can muster at them. And, this thought, with credit to one of our scaling friends, it's not my thought, this research version of an intervention is sort of like a flower that you grow in a greenhouse. And you then expect a government to adopt, implement, and pay for it, even though the government only has a desert to grow it in, right? They may not have the resources, the capabilities, and the capacities that we were able to devote to the project in the sort of research implementation of it. So then you're either trying to convince local actors to scale something that they don't have the resources, financial, human, or otherwise, to actually take on, or you're trying to retrofit your intervention for sustainable scale after the fact, which in our experience can be really hard to do. And I think my final thought is that, it didn't come out so strongly in the presentation, I really love the way in which this work has connected scaling and localization, because many development organizations are working on both, but in sort of a siloed way. And a realization that we've come to organically in our own work is that delivering interventions at the level of scale that will result in the meaningful change for a majority of those facing a challenge, you can only do that through local actors and stakeholder ecosystems. And, I started to wonder in reading an earlier version of the paper if sustainable scale might actually be a good forcing mechanism for localization, because what we're finding is that it's really forcing us to go through the exercise of thinking through who are the local actors we need to work with, what's within their capabilities, capacities, and resources, and based on that, determining what our role is. And maybe to the extent that organizations can understand that these are not two siloed efforts, scale and localization, but that they're actually two sides of the same coin, maybe that could reduce some of the overwhelm that leads to people sort of doing both localization and scale in a way that is, as the authors say, pro forma. So those are my thoughts. Thank you.
Great. Thank you so much, and bang on time. Anita, spoken clearly, someone who's worked on scaling up, who knows how it works in the field. And I really like your phrase that complexity is the enemy of scaling up. And many people have found that out to their peril. And that's one major reason why scaling up doesn't happen. And localization is another very important area, which of course CARE has practiced. And I greatly admired the work of CARE in India and other parts of the world where I've been witnessing. Thank you. So now we'll invite Varia. Varia, I hope you're impressed that I learned how to pronounce your name. Varia Lipo West, this is where I might fault, is the director of LME at Co-Impact, and Varia brings more than 2 decades of experience on evaluation and organizational learning with civil society and the public sector, and with public sector initiatives, and oversees the development of the overall learning measurement and evaluation approach at Co-Impact, which is a very key important donor today. Co-Impact supports program partners on their LME capacities as well as activities, and the synthesis of lessons and insights across Co-Impact's portfolios, which are huge and across much of the world, and the management of global research grants. Varia, I'm going to start with posing the same question to you, which I summed up by saying, can you lean on this, or do you glean light on the synthesis we've heard about, and what would be your key highlights as important to be considered, and what was missed, what needs to be added?
Great. Thank you so much, Poonam, and thank you for absolutely getting my first name right. It's Varia, and I'm sure we can appreciate having difficult names. So thank you for that. So look, I really enjoyed both the presentation, and also I have had the fortune to look at the draft paper. I realize though that many of the people on this call probably haven't had the paper, so I'm happy to send to the author some notes that are on that in particular. But to sort of lead with the first reaction to this is that, this is such a critical topic and it's so timely. And so the kind of urge to have a piece that puts together practical examples as well as useful frameworks to thinking about this is really essential. And I think the reason we can all agree, and Poonam, you yourself and others have talked about these, pilots graveyard and all of these things about, why are we in this situation now after so many years of doing development in so many different ways, but this question remains really, really salient. And so one of the key things, just like Anita was saying, that I also think is so critical is this definition, or this distinction between transformational and transactional, and I really appreciate that. And I like how in the paper and in the presentation it's about sustainable impact at large scale, where large is defined as significant share of the problem, right? And so it has to be something that is quite significant. And sustainable means that it endures over time. So I think keeping those two things together is really, really critical. And I think what I would kind of unpack here a little bit, I guess, is this idea about, what is in the transformational slightly more, because I think sometimes when doing large share of the problem can be addressed without it being sustainable, right? And so I think by keeping those together, it's really essential. And maybe linking to what you said, Poonam, about the government's role in particular, because often we're talking about systems that have the responsibility and the longevity and potentially the interest, to have some of these development initiatives actually become part and parcel and bread and butter of what they do well. And so I think core of the thing is about institutionalization. It's a word that I don't see it coming up all that much. Maybe it's yet another term that, there's so many terms that we are using in different ways, but I do want to kind of anchor on that and maybe bring it into this discussion in terms that it is about getting I think a large part of the discussion is about how do we as international development actors of different sorts align behind government's intention to serve their people better, right? And so to me, that is really kind of almost like a change in paradigm, because I like the notion of mainstreaming. I think it means sort of really adopting and kind of integrating something, but I think it doesn't necessarily mean a shift in how we view the world, right? And so I think maybe it's okay to collectively push a little bit towards this shift in how we view what needs to happen. And so it's really this lens about understanding what needs to change in a system so that system can achieve outcomes, right? And so that system can achieve outcomes for people over a long-term time. And so what would it look like if funders actually thought this way from the start, right? And I think that's a really interesting question, and I'm happy if there's space later to share a little bit about co-impact, because that is how we think about our own contribution and how we think about how we want to be as a funder, right? And so I think one of the most critical things that I would like the paper and the presentation maybe as well, but the paper to get into a little bit more is this unpacking about what it takes for funders to a little bit decenter themselves, right? And I think particularly it comes from being wedded to own strategies and wedded to our own visions of success and outcome. And I know that the presentation did talk about, well, if you want to do mainstreaming of scaling well, you have to have measurement and evaluation that goes alongside of it. But I think interrogating that more deeply would be really helpful, because I think really thinking about what funders value and what they consider a success and how that drives the decisions, right? Which we all know, it's short-term projects and it's accountability-based, et cetera, et cetera. So I would encourage the authors to, both maybe in the studies that have already been done, but then you have forthcoming studies as well, and in the kind of the framing of the paper to really interrogate that slightly more and link it concretely to the monitoring and evaluation practices of funders. How are funders defining their own success? And then this, question that we talk about all the time, but, do we care about attributing our dollars going, do we want to show that cause and effect because we are responsible, we want to be good stewards of funding, but yet it usually works against what we're trying to do if you really talk about scaling and solving for problems at scale. And perhaps the last thought I'd offer here is that, yes, I do think it's so critical, as I said, to sort of focus on national systems and actors, particularly government. I would challenge the authors to unpack a little bit, maybe complicate, I was going to say, a little bit about, is it just handing over? I don't think it's as simple as handing over to domestic doers and payers. I think there's a lot of really interesting work and experience about, what part, and particularly when you talk about resource-constrained environment and governments, right? What part of a particular innovation that will be taken up and that can be taken up by the government wants to take it up, what part of that needs to be paid for directly by the government, or it can be paid by somebody else, but then what are those key components that national, particularly government actors, need to hold so that they own it and it's their agenda, right? And it often has to do with management of a program, or it has to do about monitoring, or it has to do about data availability and so on. So it's not necessarily that we're trying to orchestrate, I think, this is what I see in practice, a very clean sort of handing over. But in this messy world of constrained resources, how are we working towards empowering national level actors to take up key roles that will enable them to be the owners of their own development agenda, if you will? So I'm very excited to see this paper come out and happy to engage further in this conversation. Thank you so much.
Thank you, Varia. And I hope I don't see time for your being able to share the wonderful work that Co-Impact is doing, but perhaps over the next 12 days, 12 long days, they may find the time because what you're doing is phenomenal. Thank you very much. And when you ended up by saying in this messy world, I was reminded of the fact that post-COVID, the mess is much bigger, especially where it comes to, one imagined that there would be greater scaling up of work in the health sector, climate change, but we don't seem to see the mainstreaming of changing systems. So yes, it is a messy world. You're so right. Even if it was a Freudian slip. Thank you very much. And now I'm going to invite Liat Kellis, who is the Director of Global Health Innovation at the, where Liat oversees grand challenges in Canada, Canada's growing portfolio of impact investment through the transition of SCALE and STARS program. Liat brings a robust experience in early stage impact investing, having previously worked with organizations like Social Capital Partners, Grassroots Business Fund, and advising social enterprises that create sustainable livelihoods for low-income communities. And Liat has an MBA from the Rotman School of Management at the University of Toronto, where she also teaches social finance, social entrepreneurship from investing, and also looks at gender lens investing. So the same question to you, Liat, as you heard the presentation, and please feel to respond to also, you have the advantage of having had two co-panelists with experience like you on it being part of the funding world where we are talking about mainstreaming, scaling up. So the same question, would you like me to repeat the question?
No, that's okay.
You get an extra one, a few seconds then.
Thank you so much. Thanks for having me. I'm pinch hitting here for our CEO who couldn't make it last minute, so please bear with me. But I too echo my co-panelists' sentiments on the presentation and the draft synthesis paper. It really resonated with me. And many of the comments already made. So I'll try not to be too repetitive, but I will speak to, in general, I think the key drivers and requirements that Richard and Johannes really put forward here, I think almost everyone speak to our experience at Grand Challenges Canada in terms of mainstreaming scaling, whether it be how thinking about scaling from the start, how it's really infused. And I like the way Anita mentioned, it really is a cultural shift, a mindset of across the organization. And for us, that's across our investment committee, our staff, our board, our advisory councils. It's really infused across all bodies and processes. And so really agree with all those key drivers that are put forward in the presentation and paper. And also really this distinction between transactional and transformational scaling also really speaks to me, and the comments made already today. What I'll say from our vantage point is that focus on sustainability and financial sustainability is so key. And at Grand Challenges Canada, perhaps because we fund such a diversity of organizations, we fund for-profit social enterprises, nonprofits, academic institutions, research institutions. For us, really thinking about, and in the way Richard and Johannes put it, about this transformational scale and how folks can do that sustainably, there's a real nuance in thinking about the sustainability and the impact and the financial sustainability of the solutions and how we're able to support that. So for that, that's really key. There's also a comment on handoffs. I know Grand Challenges Canada, I've been at Grand Challenges Canada for 9 years, and I would say at first I think we had a naivete about what handoff after transitioning to scale would look like. And to say it's complex and to figure out who the right partners are, and to do that, I mean, is an understatement. We're going through various experiments right now, working with 2 local county governments in Kenya, working with WHO innovation hubs to really see and understand the difference between our push to scale the supply side and the demand from governments and multilaterals as a proxy for government demand, to understand that, to articulate it, and to help match innovations to that. So those are the types of things we're trying to figure out in terms of that partnerships at scale and handoffs. And so saying that that's complex, I mean, I totally agree. And we definitely haven't figured it out. A few other comments I think I'll make, maybe that weren't touched upon, because I generally agreed with all the comments made thus far. One is around just this ongoing process. So for us, we've been doing this for over a decade, but it's this continuous feedback loop with our innovators and entrepreneurs, and a consistent updating and improving and expanding of our processes, our operations, our strategy, our definitions, our M&E on thinking about it. And I think that's really important. Like none of us, even those of us on the right side of that figure that Richard has, none of us, we're all still figuring it out. And it's this continuous learning process, which is really important. And I think what I'll say, I think there was a comment on one of the slides about transition to scale, being more downstream. I think that middle piece for those of the funders in the case study or that are part of this report that work in that area, that is a really difficult area to play. That's where and I really love the metaphor of the plant and going from proof of concept pilot to scale, like that middle area where there's validation and pivoting. We know it's not linear, and it's not just the sequential path that innovations and entrepreneurs are facing. And so just even, that in itself could be its own analysis of how you mainstream and support in that phase, which we think is so critical. But I think I'm at 5 minutes, so I'll just stop there and throw it back to you, Poonam. Thank you.
Thank you very much. And thank you for sharing your 9 years experience and synthesizing it so well and so quickly in 5 minutes. I have a question of the of Larry. Larry, I'm looking at different time zones, and as far as if I look at the India time zone, we are already 20, half an hour or 40 minutes behind. Is that your assessment too?
Yes, let me just offer a suggestion for the way to use our time best. We only have 10 minutes left now, and I would like to have a chance for Ben Kumpf to make some remarks. Johannes put something in the chat box I'll re-emphasize, which is that there's some really good points placed there that we're sorry not to find our way back to, but we promise to do that, both in follow-up writing and in the revision of the paper itself. So those of you who raise points that don't feel we've gotten to them, please know we absolutely intend to do precisely that. But I think we best use these minutes that we have to give Ben a chance to make some remarks, and then perhaps let Johannes and Richard make a closing statement.
Great. Thank you. That's very helpful. I was daunted by the number of very good ideas and points in the chat board, which some, Richard, you started answering. Keep at it. Thank you. Let me introduce Benjamin Kumpf. I'll be very brief so that you get more time to speak. Head of the OECD Innovation for Development Facility. Benjamin is prior to joining OECD, he worked as head of innovations at the UK Foreign Common Wealth and Development Office and led the innovation facility at the UNDP. In these capacities, Benjamin managed and many flexible funds to support experimentation, exploration, etc. And Benjamin also has experience working in countries like India, Jordan, Nepal, and Rwanda. Over to you for your comments.
Thank you, Poonam. Can you hear me?
Yes.
Great. Many thanks for this fascinating panel discussion and presentation. I sit here at the OECD working with bilateral funders, with members of the OECD Development Assistance Committee. That's 31 bilateral funders plus the European Union. And I, instead of picking up major points that stood out to me in the study, rather want to share 3 observations that link back to the study and to the points that were raised by panelists. So the first one is, yes, we are definitely seeing an increased interest among bilaterals in scaling. That's manifested in investing in staff capabilities on scaling, such as the Swiss Development Corporation or GIZ. It's manifested in stronger support for dedicated funds of scaling windows, such as Canada supporting grand challenges, the UK government investing in innovation funds that focus further on scaling, but also in dedicated innovation ecosystem strengthening funds, such as the RISA fund. And we see it, for example, in USAID investing in an internal coordination mechanism, realizing that through the Innovation Development Ventures vehicle, they really prove that some innovations work, but are not able to mainstream it into major USAID programming, and now working on the shortcoming with really dedicated efforts and even a staff position. We're also seeing, as you all know, increased interest in locally led development. And I will point to that second point that particularly Varya underscored as an important element in scaling. But let me first share a small invitation. Given that increased interest on scaling across our funders, we initiated a collaboration between the OECD EBALNet and our results community and the community that I am leading, which is called I32. It's for innovation leads among the DAC members, to develop DAC scaling principles. The idea is essentially to really build on the great evidence that has been developed by the global community, by many of your organizations, and get a small normative framing of scaling endorsed by the DAC, really to support change makers within those bilateral institutions to further push reform efforts for better scaling, but also in those institutions that receive funding from those bilaterals, be it the multilateral agencies or INGOs, and of course local organizations. So the 2 quick points, the first one related to local development and scaling. I will share a discussion paper we developed on locally led development as we are undertaking a peer learning exercise, and just invite us all to not necessarily equate this. There's no consensus what constitutes good locally led development, what is localization. We propose a working definition in our OECD paper, and that entails shifting decision-making power to local levels, and to also not assume that local communities are homogeneous entities, right? There are political values and differences in the actors. Not every government, frankly speaking, works in the best interest of its citizens. Most of the world's most poor live in autocratic societies with abysmal human rights records. And therefore, to just be cognizant of, I think, 2 things: the power funders hold in selecting who gets to kind of decide over future political priorities. And second, to realize that not all development support and interventions follow a scaling logic. Think of addressing gender equality or gender-based violence, investing in feminist organizations for advocacy and policy change. I know that, for example, Richard thinks in the end that is a scaling logic. I personally disagree. Now is not the time to discuss it, but I still do think that it's really important to differentiate between a locally led development agenda, particularly with the shifting power over decision-making paradigm, and the scaling, because that is a very often technical process. And that's my last point. There's increased interest in working in politically constrained environments, and an increasing interest, which I find refreshing, that scaling is less of a technical and much more of a political undertaking. And I think that we need to leverage. I disagree with what's been said earlier, if I'm being frank, with complexity is the enemy. I think I understand the point well, but I would argue complexity is just a condition under which we operate, if we want it or not. And how do we navigate that condition and a condition which is highly political, and not to pretend development cooperation is a technical process, I think should be an underlying way, which I see my fellow panelists nodding. We already put in practice, but let's make it explicit. Let's make it explicit that funders hold power, that it's about intervening in power dynamics, and it's highly political. How do we go from there? And with that, I want to hand it back to you, Poonam. Thank you so much for the invitation. And if you're interested in engaging on those scaling principles, please reach out.
Oh, thank you. And you've just started a debate and argument. I am sure Richard and Johannes will respond, but I couldn't agree with you more. There is a power dynamic here, and there's the political dynamic that we have to deal with, which actually makes it complex, if I may say so. All right, over to you, Richard. And Johannes, you're going to ask, you'll do a synthesis in terms of all the questions that are there in the and also all the very important points and some of the very interesting provocative points that you had the last speaker Benjamin raise.
Well, given that we're out of time, I will just say one thing and turn it over to Johannes. About this complexity issue, one of the points we make in the paper and didn't really have a chance to emphasize in the presentation is that there's now a tendency in development, and it's relevant to scaling too, that all things have to do everything. Every project, every scaling effort has to address gender, youth, climate change, et cetera, marginalization, equity. And it's not to say that all of these things aren't critically important, but I think we also have to, I think the point that, I don't want to speak for her, but I think the point that Anita was making, that is when you try to do everything, it's also difficult to scale. And we have to make explicit what our trade-offs are. If you want to do gender and agriculture, that's fine, but we can't do everything in a single project. And so I think this issue of being explicit, the literature, people from IDRC and others have developed this notion of scaling science and optimal scale and said, okay, what are the trade-offs? There is a trade-off between reach or impact at scale in terms of numbers, sustainability, and these many other issues that are critically important. What are we going to do and what are we going to not do? I think trying to be a mile wide does tend to get you an inch deep. And thinking that we can be both a mile wide and a mile deep is just not going to happen, at least not in an individual effort. And I think that relates to another point that I briefly mentioned, but really want to emphasize, because I think a lot of organizations, the smaller ones and the CGIAR are doing this, is taking a portfolio approach. If we're targeting all of these different very important issues, they don't all have to be in one single effort or one single project or one single innovation. Is our portfolio addressing scale? Is our portfolio addressing gender and climate change and these other things? So I'll stop there. Johannes?
Yeah, thank you. And we are out of time. So I'll just thank all the panelists and especially Poonam for her also opening comments. I'm delighted to hear that this notion that we need to focus on transactional versus transformational scaling got such a strong reaction, because I feel this is probably the single most important to me personal insight that I take away from this work that we've now been doing, and we will explore this further, what it means in practice, including, by the way, what it means for this whole handoff aspect that I think you rightly pointed to as needing more careful spelling out, unpacking. In fact, I don't know who it was, maybe Anita, more unpacking is obviously where you want to go in a number of these areas. And I guess for us, the challenge as we finalize our interim report and ultimately in the end of this year, early next year, do a kind of full synthesis, how much you unpack as to, again, how much you focus on key messages is going to be somewhat of a challenge for us. But this discussion, by the way, also the discussion on localization versus scaling, and particularly I thank you, Ben, for the last comment, let's not forget about the political realities, both in recipient countries and among donors, because each of them face constraints and trade-offs that we have to be aware of and we have to account for. If we don't, we may just not be terribly realistic and pragmatic in what we recommend. So these comments all been extremely helpful. Very grateful for everybody's attendance, especially also the comments in the chat, which, as I said, we'll carefully review. If you all want to reach out separately to us, you can certainly do so. We'd welcome any further comments, especially once we circulate the interim synthesis report, probably by the end of March, early April. Thank you very, very much, and all the best.